What Nigerians grow, buy and put on their plates may be silently shaping not just their health, but the future of the planet. Now, across homes and streets, corners, where processed foods are getting cheaper, vegetables are expensive, and non-communicable diseases are rising even among young people. But a global movement is urging a rethink of our diet, linking what we eat to climate change, environmental sustainability, and human well-being. Our climate correspondent Nkolia Moldu has this report.
Developed in 2019 by the Eat Lancet Commission, the Planetary Health Diet is a science-based nutritional recommendation designed to protect both people and the planet. It promotes eating less animal protein and more plant-based foods, with fruits and vegetables making up at least half of daily meals while respecting the Earth's environmental limits. In 2022, the concept evolved further with the launch of Eat Lancet 2.0, expanding the conversation to include regional food cultures, food justice, and sustainable food systems, especially for developing regions like Africa. These ideas took center stage at a hybrid training on effective reporting of planetary health diet for Nigerian journalists, organized by the Renewable Development Initiative with support from the Africa Working Group of Umvertelian Stiftung and Food Justice. Philip Jacko said the reality of rising diabetes, obesity, cardiovascular diseases, and cancers makes a dietary shift urgent. He noted that fiber-rich foods, vegetables, and leafy greens nourish consumers while placing far less strain on the environment than heavily processed or meat-based diets, adding that advocacy must push for policies that make healthy foods affordable, impose taxes on unhealthy options, and protect public health.
As we stand today, the wholesome foods, the fruits, the vegetables, are very, very expensive, while the poisons, the junk foods, the processed foods are the cheaper ones. So something is wrong. And what is wrong here is that the industry that promotes these unwholesome foods, these unwholesome diets, are working hard to hook not only older people, but also the younger generation who believe they cannot eat food without taking soda. And so our work with the media, our advocacy, seeks to reverse this trend. By the time our policymakers understand the importance of this planetary health diet and the importance of citizens that are healthy to national development, then it will be easy to advocate changes.
For participants like Dr. Oluwale, the training was a wake-up call, a reminder that what we consume must nourish our bodies without poisoning our environment.
There should be some limitation to what we are consuming, and that is the essence of this thing. We need to eat right. We need to be able to get the essentials from what we are eating, and to be able to sustain the environment. So it's not as if what we are consuming, what we produce in our land is not okay. But the whole thing has been changing because of, you can imagine some people using paracetamol to boil meat. That kind of consumption will not be okay.
As Nigeria battles a surge in diet-related illnesses, the responsibility now falls on the media to spotlight the dangers of unhealthy diets and the promise of the planetary health diet. Because informed choices, backed by the right policies, could mean healthier Nigerians and a healthier planet for generations to come. Nkoli Omoldu, AIT News.